Title card, Inspirations and Experts with Sofia Sanchez. Sofia talks about navigating healthcare with Inspiration Kolby.
Hi, I'm Sofia. What's your name?
I'm Kolby.
Well, it's nice to meet you.
Me too.
How do you manage your own healthcare?
Good question. So, with my own healthcare, I'm still on my parents' health insurance, so that helps a lot still. But I do make my own appointments when I need to, and I just do that through my primary physician. I do, in addition to being deaf, I do have hypertension, which is what I go to the doctor for a lot, which means I take a lot of medication. So having to track all of that has been a learning curve, but I've been doing it for so long that it's just instinct. Yeah.
Wow,
Yeah.
that's really interesting.
Mm-hmm.
I like learning new things, and like you said, it's important.
It is important to learn how to do it for yourself.
Yeah.
Because that advocacy is very important.
Definitely.
Yeah.
How do you track your own healthcare?
I track it on my phone on an app, and that helps me keep in check, like when my appointments are and when medication needs to be ordered. So everything's all in one place, which is really nice.
Well, that's good for you. I like when you track your own healthcare, so make sure you can know what time you're tracking your own healthcare.
Yes.
That's really nice.
It is very nice, because then I can just do it on my own and not have to go through my parents, which is really nice, and I can schedule stuff that works for my schedule and all of that.
And you can be independent.
Yeah.
I love that for you. That's a perfect way.
Yes, absolutely.
How do you talk to your doctor about being happy with your medical care?
How do I talk to the doctors to help make sure that they help me?
Yeah.
Okay. They know about my disability and being deaf, and so that helps a lot. But I still just talk to them, like I just share with them what's going on, and just if I need them to repeat something, because sometimes they can be hard to understand, I just ask them to repeat themselves, and they're more than happy to do so.
Good. I just wanted to hear that.
Yeah.
Thank you.
Of course.
Sofia gets practical tips for managing medication from Dr. Cari Croghan.
Hi, I'm Sophia. What's your name?
I am Dr. Cari Croghan.
Nice to meet you.
Nice to meet you too. I'm super excited about this.
Me too. And I heard you're a doctor. Is that right?
I am.
Nice.
Yeah.
I like doctors.
Not everybody feels that way, actually, so it's good to hear that from you.
Yeah. How's it important to take the right medications?
Right. So a lot of times we'll be taking, your blood pressure, your pulse, looking at you, feeling you, listening to you, and determining if there are reasons why you need to take medications to keep your health in order so that you don't get sicker. So if your blood pressure's kind of weird, or you might have your sugars are out of order, like diabetes, things like that, then you take medications to control that. And if you stop taking those medications, you might feel good, but your body might be deteriorating inside. They're kind of silent. They don't let you know that they're causing problems.
Yeah.
Yeah.
What do the doctors do to keep their guys to stay healthy?
Yeah, so usually when you get to the office, you'll have somebody take your blood pressure and take your pulse, and they'll ask you what medications you're taking. Sometimes it's good to bring a list, either on your phone or on paper, or some people just bring in a bag with them. We love that, so we can see exactly what you're taking. And then they take all of that information and give it to the physician, right? So then the doctor looks at what problems you've had in the past, how old you are, what diseases might be popping up at your age, and then look at the medications that you might be taking and make sure everything looks okay to keep you on course.
How do I organize my medications?
Yeah, that can be really tough. I see people bringing in baggies full of little colorful pills, that's not a good idea because you don't know what you're taking, you don't know why you're taking it, and that way you can forget things. And so the best way to organize it is to either have like a little cubby where you have all your pills and everything's labeled and you know when to take what, how often. Or you can take pill organizers. They sell them at any pharmacy. They're kind of color coded and they'll have like morning, afternoon, evening, and nighttime per day, because sometimes you don't have to take pills every day, or sometimes you have to take pills once a day or twice a day, and it can get really super confusing. I'm a doctor, I get confused. And so that's a really good way of organizing things. And then also our phones and our little electronics all over the house are so helpful. So you can say, you know, Siri, set an alarm for me at 8 a.m. every day to take my blood pressure pill. And then Siri will tell you, right? Or something on your phone where you get a ding, you know, every evening to take your pills at that time.
Yeah. What information are doctors getting?
Mostly from you and your guardians and your parents, right? And so mostly it's talking, and that's one of the best ways to share information. And so you bringing your medications in, you guys writing down the questions that you have if you've gone to an urgent care or emergency department or to see a specialist and they give you paperwork, bring that with you. Because then your primary care person, who's again kind of your quarterback for everything, can take a look at all of that, and it gives a full picture of what's going on while we talk to you.
And I take my pills in a bottle, and I take half a pink one and put the other half in there. When I take it, I have to wait for 30 minutes.
Okay.
So I eat like morning meals.
Yeah, and that can be kind of complicated sometimes, but it sounds like you're really on top of it.
Yeah, but if I don't like pills.
Ugh. Did you know that 40% of the population don't like pills, whether they have disabilities or not? That's a lot. That's almost half of us, right?
Yeah.
And some people just can't get it down. And so there are options. Compounding pharmacies can make it so that they are things that dissolve, or they can put your medication into a liquid. Some medications come in patches, and so you just put it on your skin. Some things are injectables, so you actually put it into a needle and inject it into your body. Sometimes that's better if you can't take pills. So there's lots of reasons why people don't like or can't take pills. And so there can be options, and you just need to tell your doctor, I'm not going to be able to get this down.
Is it hard to take pills?
I mean, I take like a handful all at once. I don't know what that says about me, but it can be, because sometimes things get stuck or it tastes bad. Some people actually have problems with the size or the function of their tongues or their throats. And so they literally just can't do it because things get stuck. And so then we have to get creative with liquids or patches or injectables, or things that you can put under your tongue or in your cheek that dissolve straight into your bloodstream.
What I do with my medication is old or expired.
So little known fact is that sometimes the expiration date doesn't mean anything. So if your medication is a little bit old, like a year or two, it just means that it might not be quite as strong as it was 3 years ago. And so you can actually take expired medication within a couple years very safely. But if you just want to get rid of it, the DEA website has places where you can take it. Some pharmacies actually have these big, huge safes, and you put it into a bag and you throw it in there and they dispose of it. Sometimes your doctor's offices will do that for you too. If it's kind of heavy stuff like pain pills and narcotics, sometimes you can take it to the cops and they'll take it, which is kind of fun to go to the police station and drop off your meds. If you just want to get rid of it at home, you can actually like put it into a bowl with hot water and slurry the pills around in there till it makes kind of a sludge, and then put it into coffee grounds, tea, kitty litter, dirt, things that people are not going to eat, and throw it in the garbage.
Yeah, and it's hard to take pills when we don't know how to swallow them.
Sometimes, because with water, sometimes you can taste it, and that just kind of turns you off and you can't get it down. And so some people like water first and then you pop the pill. Some people like to put the pill on their tongue and wash it back like a surfer. Some people put it into like a Jell-O or a pudding or yogurt or something so that they have like something bigger and thicker to swallow it down with. So there's a lot of different ways you can try that. One of the things I always tell people is that if you eat a piece of fruit, that's bigger than your pill, and you did get that down. And so sometimes it's a confidence thing where the pill looks really big, but if you look at it next to a spoon, not a big deal.
Logos for Northern Nevada Center for Independent Living and Southern Nevada Center for Independent Living.